Hello, good morning everyone. I'm Sebastian Cadet with Rocamed Incorporated. I'm the CEO of this company based in Orlando. We're today in Gainesville on the Urology Integrated Care podcast, where we're going to talk about a new technology that Dr. Victoria Bird is using for her BPH patients. So for those patients that have enlarged but benign prostate diseases. I'm here with Dominic, who's a medical student here in Gainesville as well, and we'll give you some detail about what this technology is about, but eventually, more importantly, what it brings really to patients. So as we talk about the symptoms of men of a certain age, and that could start early for some, and that could be later in life for others, but technically is how you urinate that evolves. As you're very young, you get strong flow, you drink as many beers as you want, and you can hang out with your friends until you have to go. At some point, you're gonna drink a beer or two, and before you finish your second beer, you have to go to the bathroom because you realize that you can't really hold as much. And what happened is your bladder over time either have been impacted by how it evolved, and because sometimes it could be the obstruction from the prostate that basically is just under the bladder, or the bladder muscle have been affected over time and are weaker, and the prostate and the bladder doesn't operate as it should. So to alleviate some of the symptoms, there are medication that can be prescribed and men are taking for some number of years, but also there are a lot of technologies that are available for different types of surgery. And most of the surgery are performed in an operating room in an hospital under general anesthesia. And obviously, as we're talking about men that sometimes have those symptoms pretty late in life, going to surgery is not easy for everyone. So not everybody necessarily is a candidate for surgery. And so having other modalities that are available could be very important for them. And what we offer here is a solution that's called an in-office procedure. So we don't have really to bring the patient to an operating room. The doctor, in this case for Dr. Bird, she'd be able to see our patient in her office, counsel them, and basically explain them what would be the best course of action for them, and offer them potentially this procedure that will be performed in the office. So for a patient, it's much more convenient to basically go back to a staff and place that he knows well, and when he would do the procedure, it will be about an hour's time by the time he walks in, get prepped, go into the procedure room, and then walk out back to his car and go back home. So it's a very convenient procedure. And one of the benefits of this procedure is also its safety, because it is done with very little damage to surrounding strictures. It is done transparently, so we go through the skin instead of going through the urethra. So it is not very involved in terms of the type of equipment that is required to perform the procedure. We only use very thin needles to go inside the bladder gland. We don't touch the urethra at all. And so most of our publications and studies shows that it has very good profile in terms of preserving sexual functions and urinary functions. So, and here Dr. Bird, for the last 5 months, I've done a certain number of patients and treated a certain number of patients with this technique. And Dominic actually have studied a little bit of the data that came out of these procedures. So Dominic, if you want to talk to us a little bit about what type of patient you have seen, what happened to them, or a bit of the medical history, how the procedure went, and where they are today.
Yeah, awesome. So in our clinic, we see a variety of patients. They're all typically older, but some are dependent on catheters, others are not. So really the process all starts with the cystoscopy. So we go up with Dr. Bird and we look in the bladder and we kind of visualize the prostate and see how things look. And then from there, we deem them as a candidate or not for the procedure. From that, we schedule them for a pre-op appointment where we go ahead and we kind of collect some pre-op data. So we like to collect metrics, numbers about how your urinary symptoms are doing, things like that, how many times you're waking waking up at night. And then we also complete a test called the uroflow, where we actually measure the flow of all of our patients. So kind of the maximum flow when they urinate, the average flow, and the actual volume of urine voided. And then after that, we get an ultrasound of the bladder to see how much urine is kind of left within there. So we have that kind of as a baseline with all of our patients, and we know, all right, kind of here's their urinary function. We also do ask about sexual health functions as well. There's a questionnaire along with comorbidities, just because one of the great things about this procedure is that some of these patients that are higher risk can have this procedure done because it is done in an outpatient setting and not needing all these crazy things done in the operating room. So after that is done, we get an ultrasound or an MRI of the prostate, and then basically we bring the patient right back to that same procedure room that they were familiar with from their cystoscopy, and we go ahead and do the procedure. It's very quick, and then once they are done with that, we kind of let them go off on their own. The catheter gets taken out that's placed during the procedure as well in a few weeks, and then we bring them back. About 3 months after, we have them complete that same form again, and they're also going to conduct that urine test as well that's going to measure their flow, their output, and then we're getting an ultrasound. And what we've seen is that the mean flow and the maximum flow have significantly improved in those patients at a 3-month time span. As for the volume of urine voided, that has also increased, and that the ultrasound, the residual urine left in the bladder, has decreased significantly as well. So we've seen tangible results that these patients are able to urinate better thanks to this procedure. It's really interesting as well. A lot of prior studies that I've looked into on this procedure, they kind of exclude patients with a prostate of a certain size, or who have maybe been on a Foley catheter for a certain amount of time. But with our office, Dr. Bird and I kind of decided that this is real life. We can't really say to patients, oh, sorry, you're not a candidate for this because of this. We're going to try and help everyone that we can. So we basically in our data are looking at patients who were dependent on Foley catheters for up to a year, patients with prostates measuring up to 200 grams, some as little as 60 grams, and the results are consistent across all of them that these patients are able to urinate better and they're preserving their sexual health function as well. So it's really a great option. Like Sebastian was saying, it's simple. The patients can come right in. It's an area that they're familiar with. They're familiar with the staff, with the doctor, with everything. And you can kind of see that they're very at ease during the procedure. And then afterwards, it's very good results that we're seeing as well. There's one specific case I'd say that stands out for sure. So there was a man, he was dependent on a Foley catheter for about a year. And just watching his demeanor change, you get to know your patients. I've been at the clinic for almost 2 years now. And when he would come in, he was a little grumpy at times, but watching him transform thanks to this procedure with time, he went from being dependent on this to urinate to being able to urinate completely on his own. And Dr. Berto is funny. She always likes to say that they can, she's gonna make them pee like a 20-year-old. And when we did his uroflow test, when he came back in, it was similar to, a test that you would see in a patient of that age. So it really was, great to see that and just watch him change as a person as well. He's very happy, full of life again, just to see that you're able to give that quality of life back to these patients who otherwise, might be deemed inoperable or a very high risk case. So we've seen it through the numbers. We've seen it kind of in person as well with the patient's just demeanor and everything. So it's an awesome procedure, awesome technology.
Yeah. Thank you. And patients have a choice. They offer choices, but again, there's very few similar technology for this kind of in-office work. And so Dr. Bird having embraced this, I think, is commendable. She's one of the few first in the US as we just basically get started with our work here to promote that technology here in the US. And it's great to have such a champion that understands a bit the space. She's an expert at many other techniques, does a lot of OR procedures. So she's seen a little bit and able to compare really what else can be offered and what this also represents an opportunity for the right patients. And so for patients, they can indeed come with confidence, really. And what I would recommend is come early. Don't wait till your symptoms to be too troublesome. It's something that don't really realize, or we said, okay, well, fine, it's okay if I wake up at night. There's better things to do. And I think for some of those stories, when you hear that patient go back to their regular life, I think that's what everybody is trying to get, a regular life. So there's another tool here that hopefully can bring a lot of men back to their regular life and bring them good quality of life. So thank you. We'll adjourn for now. Thank you to Fiesta Radio here in Gainesville, and we'll talk to you on the next segment.